Okay, hi everyone. If you can hear me, go ahead and type where you're from in the chat so I can make sure that everybody can hear me. All right, I have one person that can hear me. Okay, wow, from Trinidad, awesome. Okay, so let's go ahead and begin. So thank you for coming today and sharing this time with me. I want to really make sure that I provide some value today. And towards the end, I'm going to go over any questions you have about what we talk about or anything else that comes up. Okay. Okay, so I want to start by asking, how are you feeling today? And where are you at? Are you in a flare? Are you in remission but still learning? Are you symptom free? Go ahead and type in the comments how you're doing today. Okay, so we have one in flare maintenance, seeing a couple of in remission still learning. Awesome. A and B, yep. All right, cool. And how are you feeling about your nutrition and your IBD? Are you not sure where to start? Do you know some things but want to know more? Are you kind of in the camp of relying on forums and Google? I know I've kind of been all of these three at one point. It is so frustrating, yeah, to try to figure it all out on your own. Okay, so I'm seeing a couple of not knowing where to start. Trial and error, yeah. Okay, awesome. So some people kind of combining medication and a little bit of nutrition as well. Okay, cool. So I just want to go through. So maybe you've been told that nutrition doesn't matter, that your only options are a low residue diet, that you have to choose between nutrition and medication, that you can't do both. And I'm here to tell you that you don't have to choose. In fact, they work really well together. A good evidence-based nutrition type of support can really help amplify the other treatments that you're doing and can help you to stay in remission longer. So, and I want to tell you that there are lots of great evidence-based approaches beyond just diet, but also supplemental and lifestyle approaches too. And we'll talk about some of those things today. And it doesn't have to involve restricting every food group. I know there are a lot of diets out there, particularly for IBD, that involve a lot of prep and restriction. And if you go off of one of them and try to add on to that, you may end up with very little to eat. So it doesn't have to involve all of that. I think when you really narrow down what your triggers are, what the common triggers are for IBD2, you'll actually end up expanding your diet and including a lot more. And so that's the goal that every person I work with, that I want to try to get them to. I want to try to get them to a better place where they feel less restricted and more at peace with food and learning to kind of trust their gut a bit too. Okay. So I've worked with quite a bit of I've worked with people over the last 5 years with digestive disorders, and a large majority of them with Crohn's and colitis. And I actually have Crohn's and colitis as well, or IBD. And I've just seen what works for IBD. And so I want to share some of those things with you today, and so you can have an idea of what's possible. Okay, so this is a little bit of my story. So I was diagnosed as a student athlete in college, and my life completely took a turn. So 10 years ago, I went from athlete to I lost about 20 pounds. I had severe anemia, nausea, vomiting, unable to eat, joint pain. And I felt really stuck because I really just didn't have a lot of support. And I was told that that nutrition didn't play a role, that stress didn't play a role, and which is contrary to kind of what we know now about IBD. But really, I didn't have a lot of support and I felt really stuck. So I know a lot of you can kind of relate to that. It can be quite scary, especially if you don't have a good care team in place. So along the journey, I learned a lot about how to how to eliminate the most crucial dietary triggers for IBD, and kind of figuring out my own along the way too. And then of course, reducing stress and bringing in some lifestyle changes as well. And really the improvements that I've seen are that I am able to, it's another tool that I have in what I do for my IBD that can help me to stay in remission longer and helps with less bloating, more support, and just feeling better overall. So type in the comments if you can kind of relate to this type of story. Okay, yeah, I see a lot of the same stuff. So diagnosed in 2011, really sick in 2016, anemia. Yeah, anemia is such a big part of a lot of this. So not just from blood loss, even if you're not bleeding, inflammation alone can lead to more of anemia, which can make it hard to recover too. Okay. So let's go to, okay, so what you'll learn today. So I want to make sure that I really leave with you with some value. And I want to start by defining really what is remission and what are the different levels of remission, and then what are the goals that we can use with nutrition as a tool. And then I want to go over the common roadblocks when it comes to Crohn's and colitis, as well as the 5 different pillars that I think are pretty crucial to long-lasting remission. And then stay tuned till the end because I want to go over the #1 goal of Crohn's and colitis nutrition. So this is always in the back of my mind with everyone I work with. So I'm going to share that one at the end. And then at the end, I'll also share some resources to kind of help you move beyond this webinar to all of the next steps. Okay, so you may have heard of some of these, but maybe not. So you probably heard of remissions. That's what your doctor is always trying to get you to be in. But there are actually different levels of depth of remission. So there's clinical remission, there's endoscopic and histological remission. So that's really just a deeper remission. So that's when you look at under a microscope at the actual tissue of the gut, it's showing no signs of ulcerative colitis or Crohn's. So that's the deepest remission, and that's the one that you ideally want to get to, because if you're able to get there, you're going to stay in remission longer, and you're less likely to have flares. So that's always the goal there. Now, how do you measure remission? So this is one that some people are surprised by, because a lot of times we think of remission as whether or not we're having uncomfortable symptoms like diarrhea, occasionally constipation, or blood in the stool, mucus, but it goes beyond that. Really the only way to, of course, blood and mucus are clear signs that you're probably in a flare, but they may not be too. You may have hemorrhoids, or you may have fissures or something else that's leading to the blood. And the only true way to measure if you're in remission is to check labs. So the things that measure that would be fecal calprotectin, sed rate, CRP. All of those will kind of tell us where you're at in terms of remission, and then you compare that back to kind of the start of IBD and what it looks like when you are in remission. So in terms of how nutrition can help with this level of remission, like clinical remission, so reducing triggers can reduce flare risk. And so we'll talk about some of the triggers today. Also, the goal is to get to some of the root issues if there's any there, and definitely expanding the diet and working on deficiencies, because all of those can link to kind of stopping you from getting to remission. And we know these strategies can be helpful, especially when you're using them in conjunction with other things. So it's not just nutrition. You definitely want to focus on stress reduction. Most people need medication as well. So you may want to have a multifaceted approach when it comes to your IBD, but they all work really well together. Okay, so yeah, something interesting about IBD is that 42 to 57% of IBD patients also struggle with IBS. So this is another area of remission, which is symptom remission. So this is the irritation that we talked about. So you can have a clinical remission, but still have symptoms like bloating, diarrhea, constipation, all of that can be different from actual inflammation and the actual IBD part. So we also want to have symptom remission as well. So being free of a lot of those symptoms. So that's the other area that I try to support people in. Okay, so symptom remission would mean the absence of the irritation type symptoms, and normalized stool pattern, less or resolved bloating. And nutrition can help this by helping you really want to focus on eliminating triggers at this stage, using prebiotics and fibers help normalize stool pattern and improve the microbiome, and using behavioral changes as well if there's something standing in the way in terms of stress or even workouts if they're contributing to some of the bowel irregularities. Okay, so this is just kind of a run through of kind of all the different layers that I weave in with working with each person. We want to focus on all of these things. We want to focus on clinical remission, long-term nourishment. We want to focus on reducing the risk of flare in the future and getting to remission, obviously. So let's see here. So we want to reduce symptoms of irritation and focus on longer-term strategies to help support the gut microbiome. Okay, so some common roadblocks. So these are the most common ones that I see with people coming in my practice. Restricting too much is probably the most common one and I totally get this one because when you're trying to figure out what to eat, it can be so hard because it feels like everything's a trigger. And then if you're trying to figure it out online, you're going to find that there are all different types of diets out there and you're not sure which one to do. Do you do all of them? And so you kind of end up with nothing to eat. And I've totally been there. But this one is a big one because we really want to make sure that we don't overly restrict because it can lead to trouble repairing the body. So you need food to repair and for your body to have energy to do basic functions. So we want that, but also if you don't eat enough or enough variety, then you can end up starving off a lot of really helpful gut bacteria. And we already know that IBD patients are already low in a lot of really helpful gut bacteria. So we want to not starve off the gut bacteria either. So you really want to kind of slowly add in things that can help, so we can help expand the diet a little bit. Guessing is another area, a lot of a roadblock that people have quite often. So it can be easy to go down that route too, because as you're looking up different options for yourself or comparing to what other people are doing or your friend is doing, rather than getting expert support and finding out what's right for you, because that might be different depending on what you have going on and different complications that you have, especially when it comes to dietary changes. So you really want to seek some expert support in that area. And then the last one would be just not knowing what the actual risk factors are, what the evidence-based approach for reducing risk is. Because if you can be eliminating too many things, or maybe not enough. Maybe, you're not avoiding anything that's a trigger, but knowing what they are can actually help you, can keep you in remission longer and help get you to remission by reducing the things that are linked more to flares. Okay, so just want to touch on really the 5 pillars here for lasting remission. This is kind of some of the things that I try to take people through to make sure everything's in place so that they can feel confident in their food choices and get to remission sooner. And we'll kind of go through each of these. Okay, so the first one is creating a care team. And people often ask what I mean by care team. So a care team is anybody on your healthcare team that is that knows your case and is helping support you in getting to remission. So that typically will include a gastroenterologist, oftentimes a dietitian, nurse practitioners, naturopaths, and this is all really up to you what that looks like. So that can include a lot of different types of practitioners, but what the people that you trust the most to help get you to a better place with your IBD. And this is really important because it helps to reduce stress, it helps to reduce complications, it helps us rely on data rather than symptoms, because like I was saying before, you can feel like you're in remission or kind of get used to feeling bad to where it doesn't actually feel like you're in a flare. And then you're not really you're missing important things, like maybe your inflammatory markers are really high, so it puts you in more risk for a flare. So we really want to have a team in place so that we're not just relying on ourselves to get through this. I think that's a pretty important one. And it will help you have a more evidence-based approach so you can get to remission faster. Okay, so the second one I want to talk about is avoiding flare risk factors. So these are just some of the risk factors, and we're just going to touch on it. With an hour today, I don't think we can go into depth with all of these, but I just wanted to give some really big ones here. So a couple things. So alcohol can increase permeability, and this is just moderate amounts. So what I mean by permeability is that with IBD, when you're in a flare, the gut becomes leakier. So instead of it being tight and keeping things out that shouldn't reach the immune system, it becomes looser to where things get through, and it can increase the chance of flare. So alcohol, even in moderate amounts, can increase permeability and may play into flare in some people. Fast food is a big trigger, so that increases risk of developing IBD and also flare by about 390%. So that's a big one. And then stress. Stress is one that we often overlook as a trigger, but it can triple the risk of flare. And I know that's a big one for a lot of my patients this year, and myself too, because this year was such a stressful year for everybody. But yeah, not to scare you with all of these risk factors, but yeah, it is important to kind of know what they are so that you can focus on reducing your exposure to those things. We can't get rid of stress, obviously, but we can change our relationship to it, and we can bring in things that will help reduce stress. Yeah, I see somebody in the comments too. Yeah, bad flare this year. Oh yeah, you are not alone. There's lots of people that I've heard with IBD are having flares right now. Definitely. Okay, so let's go to the next one. Okay, so I just want to bring in an example. I changed the name of this patient, but I had a patient with ulcerative colitis with fecal urgency and incontinence, in stable remission, but still symptomatic. So still having diarrhea, still not making it to the bathroom. And what we did is we took out some of the common triggers that were still there. We also worked on her individualized triggers. And then we worked on stress, including something called pelvic floor work. You may have heard of pelvic floor before when it comes to urinary incontinence or trouble holding urination. But pelvic floor work can also help with IBD, particularly with fecal urgency and constipation. And I think the study I saw in this showed that even just a couple sessions reduced fecal urgency by about 78% and reduced constipation in those that had that about by 83%. So it can help quite a bit. So it's not just food stuff that I work on with people. So yeah, in this particular case, she was on Imodium pretty much every day for 7 years and on the max dose. So we helped her find other tools and different things that she can use, food-based approaches too, to help her to be able to come off of Imodium. So we brought in things like resistant starch that can help with fecal urgency. We promoted the foods that can help support her gut microbiome to reduce fecal urgency. We brought in other prebiotics as well to kind of help normalize stool. Okay. The other one I want to talk about is supporting your gut microbiome. So this is microbiome is meaning all of the different gut bacteria that are present and yeast in the gut that meaning all of the good and the bad. But we know that people with IBD tend to be lower in a lot of beneficial gut bacteria like Faecalibacterium and Bifidobacterium, Lactobacillus, Akkermansia. So we want to do all the things in the diet that can help to increase that. And we also know with IBD that the gut barrier is leaky. So I know we talked about this a little bit previously, but this is a good picture to kind of show what that actually looks like. So you have, I don't know if everybody can see that picture, but you have a nice, in a normal healthy gut, you have a nice mucosal layer, which is that pink layer above the cells of the gut. And that's actually protective. It protects the gut barrier and protects your immune system, because just below the gut barrier is something called the GALT, the gut-associated lymphatic tissue. And that's where 70% of your immune system is. So you want to really support that barrier so that things can't get through and trigger the immune system. And it helps to keep a nice balance of these gut bacteria. So you want to make sure you're feeding up all of the good bacteria so that the more harmful gut bacteria that tend to eat away at the mucus layer are kept in check. Because you can see these pink little circles, those are the mucus degrading bacteria. So whenever you starve off certain gut bacteria, those grow in population, and then you can have a disrupted gut barrier. So we know that with IBD that the leakiness is there. This is something that happens with flares, and we want to be able to use things that help to support the repair of that, to help improve permeability. And there are plenty of good evidence-based tools that do that, both dietary and supplemental. And we also want to increase plants in the diet, because your helpful gut bacteria all feed off of the things that we don't eat. So when we consume food, we don't actually consume fibers and resistant starches and the color pigments in food. That actually is what our gut bacteria consume. So it's, for example, with resistant starch, it's called resistant because it resists digestion and then makes its way further into the digestive tract to feed up all of the gut bacteria, typically helpful gut bacteria. So we also want to adapt the diet to stool patterns. So there are certain foods with constipation that you want to increase, that you want to avoid in diarrhea. So some things will ramp up movement through the digestive tract, and others will kind of help slow things down. So you can kind of adapt the diet a little bit to fit each picture or fit where you're at. And then you also want to bring in foods that help support the gut microbiome of IBD patients. So you want to bring in lots of plants, like we just talked about. Okay, so another example of this. So For example, in this patient who had Crohn's, they had weight loss of 20 pounds, were skipping meals as well. They weren't sure what to eat. So what we worked on is figuring out the common triggers. We also found that they had a individualized trigger, so they had an allergy. And once we were able to narrow down what that was, taking that at the diet made a big difference too. And then we worked on expanding the diet and finding safe foods so that we're not skipping meals. And that allowed her to finally have the fuel that her body needed to start doing some repair. So this particular person was had Crohn's for 20 years and had never been in remission. So dietary approach really was kind of the missing link for her to help combine what she was already doing to help get to remission. Okay, so this is a big one too. So modifying our relationship to stress. So because stress triples the risk of flare, it's one that we still want to pay attention to, even if we don't feel like we're all that stressed. There are lots of different types of stressors. Even exercise can be a bit of a stressor. So if you're overworking or doing more high intensity training, that can be a stressor to your body depending on how you're feeling. And stress can impact fecal urgency and trigger more gut symptoms and more activity in the gut. And it impacts our immune system quite a bit. So stress reduction might look like gentle movement versus high intensity. It might look like more breaks and rest, asking for what you need. But this is different for everybody. You might, maybe meditation is for you, maybe not, maybe you hate it. Maybe it causes more stress, but yeah, stress is definitely one that you really want to make sure you're including stress reduction techniques. Make sure you're including that because there's such a big link with it increasing chance of flare. Okay. And then the last one would be the monitoring and restoring what's low. So deficiencies are quite common with IBD. And so iron's really commonly low because of inflammation and also blood loss, but vitamin D as well. We know that one's correlated with the risk of flare. It's also involved in preventing and supporting our immune system so that we don't get sick often. And it kind of acts as a light switch for inflammation. So kind of turning on and off inflammation. So it regulates all of that. So it's one that we want to make sure that we're getting in adequate amounts, that it's not low. And then it also helps improve how we handle helpful gut bacteria. So it helps keep helpful gut bacteria in the gut, which is important for us. And we know that it's correlated with risk of flare when it's low. So I usually suggest my patients always get this checked at least once a year to make sure you're not low, because that can play a big role. I see that quite often in IBD patients. And then you also want to monitor iron and zinc. Iron and zinc plays a big role in gut barrier as well, and the immune system. And then a lot of your B vitamins will also kind of indirectly play a role in affecting your remission and your ability to recover. And then we want to make sure that we have enough food in the diet and fiber to help support repair. So fiber actually helps support repair by supporting gut bacteria, which produce something called butyrate or short chain fatty acids. And these are the things that I refer to as postbiotics. So if you've probably heard of prebiotics and probiotics. So prebiotics feed good bacteria. Probiotics are helpful gut bacteria. Postbiotics are the things that helpful bacteria produce that have big effects throughout the body and especially the gut. So butyrate's one of the ones that's most talked about. It helps to fuel the cells of the gut as well as repair the lining. So when we talk about the leakiness, it actually helps to repair that and reduces inflammation locally in the gut and also systemically, so throughout the body. So fibers can help do that for IBD patients, particularly if we're using fibers that are safe for them, not a food trigger, then it can help to do that. So that's a major focus of the work that I do with people. Okay, so we're down to the #1 goal for IBD nutrition. And it might not be what most people would have guessed. So diversity and expanding the diet is what I think is the most important thing for IBD patients. And the reason why it's so important is that it supports increasing helpful gut bacteria like bifidobacterium and Faecalibacterium, Akkermansia. It helps our body support the growth of those without having to take, a probiotic. So it helps our permanent residents. So probiotics are more like temporary visitors. So when you take a probiotic, it's temporary. Prebiotics and helping support diversity, those are helping to increase the populations of those gut bacteria that are already within us. So we really want to support diversity. And we do know that in terms of diversity, they've done in the largest gut microbiome study, they showed that about 30 different plant compounds every week is kind of the sweet spot for diversity and for gut microbiomes and gut health. And we know that IBD patients struggle to find foods that work, that we often have low gut flora, low helpful gut flora, and leakier barriers. And identifying those triggers can help expand the diet and help reduce risk, help support repair and inflammation reduction, and can help with reducing the chance of deficiency. So it actually helps us hang on to nutrients better. And if we're supporting the gut bacteria also produce nutrients for us. So that's why we want to really make sure that we're not neglecting that part. And increasing the helpful gut bacteria can help decrease urgency, can help support inflammation reduction, and can even help with mood. So that's important. So you might be thinking too, how in the world do we do this? This sounds really awesome. Yeah, it's a whole nother thing when you think about implementing some of these things. So I want to ask you too, what value do you think you got today so far? What are you most excited about implementing? So feel free to type in the comments. So B, expanding the diet. I see one of those. Okay. Stress reduction, that's me too, for sure. All three. Expanding the diet, awesome. Reducing triggers. Okay. Expanding the diet, reducing triggers. Stress reduction. Stress reduction, yep. Yeah, so lots of people in my camp. Okay, what are you hoping to achieve with nutrition? So if you have anything, feel free to list it in the comments. What are you most excited about implementing? Yeah, side effects of meds, I hear you. Yeah, so it's another tool that you can use to help to help you stay in remission longer, to be on meds with less side effects potentially. Okay, a lot of people really relating to the expanding the diet part, which is totally not surprising to me. Feeling confident. Yeah, I'm okay. Feeling confident, not worrying about restriction. I can totally understand that. Giving the meds the best chance to work. Yeah, I agree with that completely. Yeah. Yeah, diet's such an important part of that. Can help support the immune system quite a bit. Okay, so where are we at now? I want to ask you, what are you ready for? What are you ready for right now? And where do you want to start? So you might not be sure where to start, or maybe you're unsure of what the how and the why. So you may not understand why all this is important or how to implement all of this. So let me know in the comments what you're thinking with that. Ready to get on a proper diet. Awesome. Overcoming fatigue. That's a good one. Not sure. Okay, not sure where to start, not sure where to prioritize. Malabsorption. Yeah, malabsorption, definitely an issue. Okay. Okay, so just to remember that everything I shared with you today, it's not based on theory. It's based on what actually works for IBD and what there's evidence for. So it's evidence to support these strategies, and I've seen it be helpful in so many different patients. And this is why I really think that that it's time. It's time to stop guessing. It's time to finally have the support you need. It's time to also to get support in this area, especially if you're in a flare and trying to figure it out on your own. Can really help you reduce stress and you know, I find it when I'm in a flare, I get kind of what I call flare brain, where you just everything seems sad and hard, and it's hard to really think about what your body needs in that place. You really need a team, a healthcare team of people that you trust that can stand in for you when you're not thinking clearly and you're not feeling great. I think that's really important. So yeah, if you don't have nutrition support, I'd encourage you to ask your doctor to connect you with a dietitian, or I'm happy to offer some free support as well. I do free 45-minute calls for people to kind of get you started on thinking through some options. And I also really wanted to share a tool that I put together for those with Crohn's and colitis. And this has just taken me about a year to put together, and I'm really excited to be able to offer it. It's going to be a really fun thing. So I want to share a little bit of that too. Okay. Okay. So let's see. Okay. So this is the course that I just created. It's an 8-week course. It's called the Crohn's and Colitis Remission Blueprint. And it's designed to get you to remission, to empower you with the knowledge and tools of everything that's out there. So I've combined, this is kind of the latest up-to-date research. It's got a lot of the research that is available for IBD on IBD Nutrition, about the diets, about deficiencies that are important to look at. It's kind of your roadmap to kind of get you to know all the things that's important. And they're really bite-sized and easy to understand. So yeah, it's taken me a while to put it together, but I really wanted to take the things that have been working for a lot of my patients and put it into a course where you can really be empowered by it and take the tools and keep them forever, and be able to always have that. And I plan to update this, you know, every year as new stuff comes out. And I know new stuff will come out because the gut microbiome is such a hot topic right now. There's stuff coming out all the time. So I'm excited to be able to offer this to people. Okay, so let's get into what's included. So it's 8 weeks, but I'm gonna go over each of the modules so you can kind of see what it looks like, but it's a learn at your own pace. So there's no pressure to kind of get it all done then. Bite-sized modules, so they're like, I try to keep them under 10 to 15 minutes. Most of them are like 5 to 10 minute little short lectures. And so I take the concepts and I really break them down so that you understand everything that's out there so you can make better informed decisions. And then there's live bi-weekly, sorry, that's supposed to say bi-monthly, so twice per month, live Q&A calls that are group coaching. So I can provide a little bit of group coaching there, answer any questions that's come up as you go through the modules, and we'll have little short topics and guest speakers as well. And we'll be learning how to manage flares better to reduce your risk. It's kind of a breakdown of everything that's out there, breakdown of supplements. So what are the evidence-based supplements and what types and what dosing? And then I'm definitely going to provide lots of different meal plans, over 25 different handouts, recipes, and checklists, and discounts, as many discounts as I can find for you around supplements or whatever else I'm recommending. And then, and then I really am confident in this program. So if you don't like it in the first 10 days or so of doing it, just let me know, and I'm happy to give you your money back as well. Okay, so let's go through the little modules. Okay, so the first week, so this shows some of them. There are a couple more on here that are more practical application, but we'll just go over the basics in the first week about what is IBD, what's the difference, what are the signs, how does that compare with IBS, what are the treatment goals, so what is most important when it comes to nutrition, and how do we implement that. And week 2, we're going to go over all things gut microbiome. This is actually one of the funner lectures, but we'll get to know all the different helpful gut bacteria in your gut. You'll get to know them. You'll get to know some of the harmful ones. You'll get to know all the different influences on the gut microbiome and the different changes that happen with IBD and how to modify that, how to modify your diet to help support. And this is the one that I think people most look forward to. It's all about the dietary approaches. So what the aim of the diet is for IBD. And then I go into a little bit about what's the evidence for some of the diets that are out there and how do we use them, and or do we use them? So I'll help you evaluate specific carbohydrate diet, the low FODMAP, MRT, elimination diets. We'll go over each of those, the evidence that we have for them, what the cautions are around using them. And I'll just really help you break it down so you don't have to go and read the research yourself, but you can leave that week kind of feeling like you can make an informed decision for yourself. And then I'll go over kind of what the type of dietary approach that I recommend to my patients and what I've seen as well. And so you can kind of look through all that. Okay, so week 4, we'll go through the digestive tract checkpoints. So in the mouth, stomach, small intestine, large intestine, all the different important things that have to be there, like in the stomach, for example, what your stomach acid actually does, and small intestine, where bile is secreted and what happens if it's not secreted in the right amount, and the different checkpoints that are involved in a working digestive tract and what can go wrong. So it can, in different tools that can help you support each phase of that. Okay, this one is also not showing all of them. This is just a rundown of the first part of week 5. So we'll do an intro to supplementing, we'll do anti-inflammatory supplement advice, and food-based approaches as well. So it'll be evidence on all the different types of approaches, maybe some that you haven't even heard of before. So that'll be a run through of that. I think this only shows about half of what's there. And then week 6. So week 6, we'll go over different myths about probiotics, how to choose a good probiotic. I know somebody asked about probiotics on here on the chat. yeah, so we'll go over all the different probiotics for IBD, what the evidence is. We'll go over prebiotics, and also we'll go over symbiotics and postbiotics, which are less talked about, but I did mention them a little bit earlier. So we'll go through all of those. Week 7 and 8 are going to be all about implementing. So we'll go over food and mood, mindful and intuitive eating, movement, eating out and travel. These 2 weeks, I'm also going to ask the people that join the group program, I'm going to ask for some suggestions on modules. So I'm actually going to add to these based on what other people are wanting to know about. So I've left some room for that towards the end. Okay, and then the other thing that I think really provides a lot of value for people are the handouts. So I'll have several, I believe I have 3 ebooks that I'm going to do with the course. There are 2 flare-friendly weeks with grocery list of meals, as well as 2 weeks meal plan to help you expand your diet. Also with grocery list, a list of what to avoid and things you can be flexible with, and alternatives for things. So if you can't have, you know, if gluten or dairy is a food trigger, what are all the best options for that? What are the best brands, or the ones that taste the best? I have a list of those options. And we'll have lots of handouts covering probiotics, digestion, omega-3s. So if you want to be able to read a lot of these things too, there's going to be a lot of support around that, or see visuals, kind of have some, like a hard copy of something. This will be great for that. So over 25 different handouts, and they're yours forever. So that's another really good thing about the course, is that yeah, it's not just for now. You can keep these, and it's lots of really great value. So yeah, I want to ask too, what does this course sound like something that you would be interested in doing? So maybe give me a shout out in the comments with a yes if you kind of feel like this sounds interesting to you. Okay, a couple yeses, awesome. Yeah, depends on the cost. Okay, so we're gonna go into that too. So yeah, really the aim is to allow you to have less stress about what you're gonna eat, to feel confident about your food choices, to get into symptom remission, and to help you get to remission, clinical remission as well, to be able to be active, to travel more. And I truly feel like a solid nutrition plan can help you get there, and is the missing link for a lot of people. Yeah, so imagine what it would be like to feel confident in your choices, to wake up knowing what to do, to know that you're nourishing yourself, to have all the tools in place. So this is really the aim of the course, and what I really hope you walk away with. And okay, so we asked about the investment. So this is the price. So the October 13th, the price will actually go up to $497, but up until October 11th, it's only going to be $297. So I know there's a lot of different courses out there, and they're quite expensive. A lot of them are in like $1,200 and have less value. So I know that this is, I really want this course to be worth it for you, and I really think it is. So yeah, so this price is, so I'm going to provide you with a link to, so someone asked on here about time zones. I'm not sure what you're meaning there. Oh, time zones meaning for the live Q&A. Okay, so yeah, with the live Q&A, it will be recorded. Okay, you're in the UK. Yeah. So I'm thinking I'll plan on having it, I haven't picked a time, but maybe depends on the group in terms of where everyone's located, but I'm thinking it'll be in the Central Standard Time in the US. But maybe like a 12 p.m. on a Friday, but don't worry, it'll be recorded. And I'll also provide you with a place where you can ask questions ahead of time and have them, and so that I can answer them for you in the course and then record it. Okay, so I'm gonna link you in the chat with the link to the course. A couple people asked for that. And I'll also email this out if you came to the course or if you're on the list for this webinar, I'll make sure to send that out as well. So that's a link that will be active up until the day before the course. Again, the early bird price will be available until then. And as far as availability, I think the course can hold up to, I believe, 100 people. So, so it'll be available to the first people that are able to go. Remind me how long each webinar in the course lasts. Okay, yeah, that's a good question. So in the, let me go back. So some of them, let's see. Not all of them list how long they are. So looking at this one, so some of them are 3 minutes long, some of them are 10 minutes long. They kind of range. I try to keep them really short and bite-sized so that you can kind of, so it kind of keeps your attention and is still interesting. Okay, yeah, so I think maybe the longest one is maybe, I might have 1 or 2 in here that is 15 minutes, but okay, let me go over to the questions and see if there's any more. Okay. Okay, and I'm gonna also go over the ones from Instagram too. Is it per week? Do you mean the course modules? Are the course modules every week? Is that what you're asking? Yeah, so every week you'll get different course modules, the length of each one. Okay, so this one does not show the time. I haven't published those. This one does show the time. So this is week 3, for example. So it gives you the time, the length of each little lecture, and these are all, they all open on that the 3rd week. So you get, on the 1st week, you get week 1, the 2nd week, week 2, and so on. Yeah, there's several per week. So example, week 3, you get all of these here, and there's a couple that aren't listed. I just kind of highlighted the top ones, or the ones I thought you'd be most interested in. Okay, cool. All right, so someone on Instagram asked, is it okay to do a nutrition approach with meds? I'm trying hard, but feeling shame from relying on meds. Yes, it's totally okay to do it with meds. And I will reference, I have a handout that I'm doing on supplement and med interactions so that you can keep track of that and always have a list of those. And but yes, everything that I mentioned in the course is okay to try with meds. Of course, you want to talk to your doctor just to make sure, but I'll always reference that in each thing that I recommend. But nutrition is totally safe to do alongside meds. In fact, I would suggest that. Someone asked, when does the course start? So the course starts on October 13th. So that's when it'll start, and then it'll run through December 1st. So the new modules will come out every Tuesday after October 13th. So the first week opens on October 13th. Okay, so a couple of you have to leave. That's, yeah, totally okay. It'll be recorded, so if you miss any other questions, I'll have that sent out. Okay, gonna go through some of these other questions. Are there dietary risk factors that make you more likely to have a flare? Yes. So that one I think we kind of already answered in the webinar, but yeah, I do have, I believe it's in week 2, there is an extensive list of different triggers and the evidence for them and what to avoid and why, where I go into more depth as to the why. So why is it so important to avoid these? So we kind of touched on a little bit of that today, but it's hard to kind of really go into depth in such a short webinar. Okay. And then beyond nutrition and meds, what other factors can influence my IBD? So we kind of touched on that too. I would say stress is probably the biggest one, being that it triples the risk of flare. So that's a really big one. But, you know, other stressors too that you might not have thought of, like, you know, like a really busy schedule or too intense workouts if your body's not fully recovering well. Okay, what resources are available to master learning nutrition, the nutrition part? Yeah, I mean, I think so that one's from Instagram too. So I really designed the course to be that. And since this is the first time that I'm launching it, I'm going to be asking the group what they want to learn about. So it'll actually be a really neat, fun thing, because you'll get a chance to kind of influence the material that you learn about. So I'll be asking every other week in the Q&A what you want to learn about, and then I'll create modules to kind of add to what I already have. So it's going to be really fun. So yeah, it's designed to really help you master it so you can make better informed decisions. And that's really what it's all about. It's not about me telling you what to do, but it's more about you having the tools in place so that you know what's best for you. So that's the goal of all of it, really. Okay, any other questions? I think we might wrap up pretty soon. Okay, a couple questions about, yeah, so it starts October 13th. The last day to sign up for early bird price is October 11th at 12 p.m. I'll send out an email about that, and I'll also post on Instagram. And yeah, it runs through December 1st. And the Q&As are every other week, and they're recorded. So if you are international, that's totally okay. It'll still be recorded. You can still ask your questions. So it's open to anyone. All right. Did everybody get the link okay? Okay. I'll also send it through email in case you didn't see it. Okay, awesome. Well, thank you so much for hanging out with me during your lunch hour or wherever you're at, or dinner for some of you. But yeah, thank you for joining me, and I hope to provide more of these in the future, and hope to see you in the course. All right, bye.